affects between 3 and 5 million people a year and causes between 100 and 130,000 deaths. It is an infection in the small intestine caused by the bacterium Vibrio cholerae. Its main symptoms are vomiting and diarrhea. These symptoms occur between 1 and 5 days after the ingestion of the bacteria. It takes a minimum of 100 million bacteria in order for these symptoms to be manifested. Children are more susceptible to cholera, and it is the second leading cause of death in children under 5. Transmission occurs in fecal contaminated food and water.
Vibrio cholerae includes 2 circular chromosomes. These chromosomes contain 4 million base pairs, which adds up to 3,885 genes. A bacteriophage called CTX5 inserts its genetic material into the chromosomes of Vibrio cholerae. This genetic material in blue is what produces the cholera toxin. This bacteriophage can also transmit this genetic material between strains of Vibrio cholerae.
The cholera toxin contains 2 A subunits and 5 B subunits. The B subunits here bind to the epithelial cell wall, triggering the endocytosis of the A subunits. Once the A subunits are within the cell, they are cleaved into 2 peptides, one of which binds to the G protein, right here. This prevents the G protein's inactivation. One of the roles that the G protein has is the stimulation of cAMP. If the G protein is prevented from being inactivated, it will generate excess levels of cAMP. One of cAMP's roles is the regulation of ion channels. If there are excess levels of cAMP, essentially what happens is these ion channels are blocked, and key salts such as Na+ and Cl- can't get into the cell. This causes an influx of water from the intestinal cell out into the lumen. This results in the symptoms of diarrhea and vomiting that we see in patients with cholera.
Oral rehydration treatment, or ORT, can be effectively used to treat 90% of diarrheal dehydration cases. The oral rehydration salts mixture includes glucose and various salts combined with water. 20 years of biology, chemistry, and biotech research has refined the ORT recipes, effectively improving outcomes and reducing the need for other medical intervention. In cases of cholera, the most severe dehydration occurs in the first 24 hours of illness. Infected adults require 200 to 350 milliliters of oral rehydration therapy per kilogram of body weight. For an average healthy adult who weighs 70 kilograms, this would be 21 liters of ORT solution in the first 24 hours. Zinc supplementation is recommended as well. Zinc helps reduce the severity and frequency of diarrheal episodes in children. The recommended dose is 10 to 20 milligrams per day for 10 to 14 days for all children with diarrhea.
The WHO and UNICEF encourage the preparation of personal ORT solutions at home. They recommend the following recipe: 1 liter of pure water, which is about 4.2 cups, with the addition of 1.5 tablespoons or 16 grams of sugar, and 1 teaspoon or 3 grams of salt. This solution is sufficient in the ions and materials we described before in order to help prevent dehydration. This solution should be administered to children with mild to moderate diarrhea in amounts of about 1/2 to 2 cups after every loose stool. Adults should also be given this solution in as large of quantity as they would like after each loose stool.
The administration of glucose, salts, and water to a patient in oral rehydration therapy effectively increases the concentration of these materials here in the lumen. Since the glucose transport mechanism follows a different pathway than that which causes dehydration in patients with cholera, essentially, we can use this glucose-sodium transporter here to get these essential materials into the cell. This then causes a favorable osmotic balance towards getting water into the epithelial cell. Therefore, these steps minimize the symptoms of diarrhea and vomiting we see in patients with cholera.